Have you noticed that you're slowing down your activities or you can't do them to the level that you previously wanted to do? That's a little frustrating. Now, age, of course, is a little part of this, but it's not as big as you think. Now, there are a lot of factors involved with why you're slowing down, and not having specific exercises after your treatments is a huge part of it. I'm going to tell you why in this video. Hi, I'm Kim Massell. I'm the owner of SoulCore Fitness. I've been in the health and fitness field for 30 years. I'm a Soma therapist and Soma trainer. So for those of you who don't know, it's a osteopathic manual therapist, and you can say an osteopathic trainer. And prior to that, I started a personal trainer. And before that, I've been in sports my whole life. So in all this time, whenever I went get treatment, up until I found my recent profession, I was never really given something specific for my issues that I went there for. I was either given treatment and then nothing else, or treatment and then exercise that everybody did. That, I'll be honest with you, helped a little, but not a lot, and actually led to more issues than good, which we'll talk about later. But it wasn't until I found out that the body wants to be stimulated, educated in a lot of different ways, and that treatment and exercise go hand in hand. They have to work together. It's a holistic view of looking at the body. Not just, I'm gonna do this one thing for you and you're good. The body doesn't respond that way. So in this channel, I'm gonna talk about things holistically. I'm not gonna give you 1 or 2, 3 exercises to do something for something you wanna accomplish. I want you to understand what's going on so you have a better approach so you can get sustainable results. So I'm gonna talk about that in this channel. So if you wanna hear that, then subscribe, hit that bell. We're about once a week I put in new videos. Please like and share this video so that I can reach more people and help them. Wear and tear, and then next level injuries always need some sort of therapy. And therapy we usually think of as going to see somebody like myself, an osteopathic manual therapist, or a chiropractor, or a doctor, or DOM, or a massage therapist, or fill in the blanks here. Some sort of therapist to take care of the symptoms that we feel. But the best form of therapy is stretching and exercises. A consistent stretching and exercise program specific to what you need. But when you go to these therapists, most of them, not me, you're not giving a program for these specific issues. You're either giving no program at all or a handout of exercises with people with similar symptoms, but you're a different person, so it could come from a different cause. Now, it's not the practitioner's fault. Sometimes they're just not taught this, so they can't give you what they don't know, right? Or if they're taught this, they're taught this in a system that's not the best, right? It's symptom-based learning. If you have a symptom, here's what we do for the symptom. And then you also need to teach it in a cookie cutter way. Because for business, like McDonald's, you want things to be repeatable, right? I want to be able to teach this to each person so they can do a similar thing and get hopefully good results. Well, it doesn't really lead to good results. And unfortunately, this system and the fact that people don't know what to give you is not advantageous to you. Now, don't get me wrong. Hopefully, and more than likely, you'll get some results from these practitioners you find, right? You'll feel better, you'll move better, you have less pain. That's good, we want all that stuff. But unless you give yourself a stretching exercise program that corrects the issue, you can say that your results, lack of pain and movement, are on top of an asymptomatic issue. You still got it, but you don't feel anything. And the problem with that is you think you've solved it, but you haven't. Now you go back out into your day and then you go back to your life, and then depending on your level of activity, it's gonna come back again somehow, whether right away or I've seen over the next couple of months or a year, but it'll come back. And when it comes back, it's worse. And it's worse for the symptom that you feel, but it's also worse for your body because your body accumulates, learns about the different changes in your body, good or bad. It'll adapt to bad changes. And the longer you have these changes and the body adapts to these bad changes, the harder it is to get out of this issue that you're having. Now, these issues come from wear and tear. Wear and tear just happens in life, and then also the activities of sports that you like. Depending on your level of life and activities of wear and tear will depend on how much wear and tear you get on your body. So you need to understand what you're doing in your life to correct these issues. But we don't think about it that way. We think about, okay, I'm going to use my body to live life and to do my activities, right? So let's take me, for example. I have this business. I have 2 kids, young kids, and I like to work out. I like to ski. I like to run. I like to do those things. That's a lot of wear and tear on my body. I understand that, though, in the profession I have now. And so there's a lot of things I do just continuously over the week to do to normalize, as we say in my profession, my body. I always want to bring my body back to normal. But we don't think about that way. We think about using our body as a tool to accomplish what we want, right? To live the life we want. There's nothing wrong with that. But we don't think about the other aspect, that I want to use my body, but then I also want to give my body, as I say, some love, right? To keep it as balanced as possible. You can say that you have a body that's meant to be balanced in place, right? And let's say it's good balance until, I don't know, let's say college, right? So you start going to college, when's that? Like 18, 19? And then you start to sit a lot, you do activities, you go out, you have some fun, your body starts to slowly become unbalanced. You won't feel anything because you haven't had enough damage to your body to feel anything at that time, generally, right? But over the decades, right, you go from college, then you get a desk job, and you continue this type of activity. You're using your body to live your life, and then whatever activities you love, and you're slowly, you can see I'm leaning, you're slowly taking your body more off balance. At a certain point, your body's going to tell you this is too much. And it starts small by tightness, and then maybe some immobility. There may be some intermittent pain here and there. Then consistent pain. And then you're on the track of progressive medical intervention. All because you didn't think about taking the time to do some stretches and exercises with a therapy to keep yourself in place and balanced so that you give your body that love so you can continue your level of life until you decide one day to die. Here's some examples. So let's say you're in your 20s, you've just graduated college, you found a desk job, it's your dream job, but you know you're gonna be sitting at your desk for 34 hours per week and the load that happens. Well, if you understood this concept I'm talking about, from the very beginning, you would seek out a practitioner like myself and go, hey, I'm gonna be at my desk for this long. I also like to go to the gym to work out. I like to go ski. I like to run, walk. I like to be active and I want to stay active. Okay, great. If you see me, I say, okay, come to me once a month, once every 3 months, do some treatment for these tendons and ligaments that stretching exercise can't get to. And then here's your exercise program for you to do about 3 days a week, along with whatever exercise program you want to do. If you did that, then your body would stay basically balanced outside of something acute for a long, long time. You'd adapt as you go along, but for the most part, this potentially 15-minute program, right, that you do 3 days a week would stave off the bad things that are gonna come, which is this example, what I normally see. You graduate, you have a desk job, you get your desk job, and you don't do anything about it. You just power through this desk job because you want to get good at your job, you want to make more money, you want to have money to live more life. Great. So you use your body continuously, never stopping to give it love. You're working out, you think you're doing the right thing for your body, but that working out actually compounds the issues you're getting from sitting at a desk. Tight hip flexors, lower back pain, a forward head posture, things of this nature. When you exercise, you're reinforcing this bad posture. And then 20, 30, maybe 40 years down the line, you've got an awful posture, you have chronic back pain, and now basically you just want that pain to go away. Now, going through a corrective exercise program seems too much because it is a lot, right? It's going to not feel great because you're working through all these levels of dysfunction and bad tissue over the decades. So you just want it to go away, but now you're at the subject of the medical community. Now you get a cortisone shot, or they want to cut something out or scrape something through here. That's their solution. But that's not a solution. That's an expensive Tylenol, right? You just want to get rid of the pain, but it's really invasive, right? So you can correct these things at the beginning, but you want to correct them with specific exercises. I'll give you an example of me now. If you've been watching for a while, you know that back in my 30s, I got a disc compression at L4-L5 and I got sciatic pain. And prior to that, I did what I thought I was supposed to do, right? I did exercise I was supposed to. I went and saw a chiropractor, a DOM. What else did I do? I did everything I was supposed to. I ate plenty of good food. I drank tons of water. But I ended up getting this anyway because I wasn't specifically doing what I needed to do for my body. I'd played tons of sports in my life, hardcore sports. I'd worked out very hard all my life. I had never been given any type of reasonable corrective exercise program to do with it. I was given the BS shoulder thing when I hurt my shoulder, which didn't help anything. And when I hurt my back after sports, I was given the same thing everybody gets. You go to a PT and they're giving the same exercises, right? Here's your piece of paper. Do McKenzie press up, McKenzie press up, do a clam exercise. Then that's all I got. I got that. And that's what I see people who come in here, they get the same thing. Now that can work for maybe 1% people. For the 99% people, it's not gonna work because it's not specific to them. Let's go a little more in depth on how using treatment and specific exercises work hand in hand. Let's say somebody comes in with IT band issues, right? So IT band is your retractus iliotibial band. But your IT band is made up of 3 muscles: your TFL, your glute med fascia, your glute max muscle. This is called your deltoid of far above. TFL, glute med fascia, glute max muscle. Deltoid, like the shoulder, of fair buff. I don't know how to spell that. But it goes all the way down to your leg, down to your knee, and has a bunch of different insertions. Not just one insertion, has like 3 or 4. But this is also part of your whole leg. So it's not just your IT band, it's your tractus iliotibial band. So we have those fibers of the IT band in conjunction with the horizontal fibers of your fascia lata, your thigh fascia. And they intertwine, they go together. So somebody could come in and go, oh, my leg hurts here. And they go see a PT, for example, right? And PT goes, oh, you got IT band inflammation. You have a tendonitis of your IT band. Okay, great. And they give them, maybe they do some stim or whatever they do for therapy, and they give them the clam exercise. So the clam exercise, I don't like this exercise at all, but the clam exercise, it only works to a little bit one of your fibers of your glute med. So your glute med has 3 fibers: up front, more toward the TFL, a middle, or a back, more toward your glute max, which is part of that deltoid far above. So that clam will work mainly just the middle one, but it doesn't totally work it by itself. It works in conjunction with your piriformis because they allow for extra rotation. It means the hip is going out. If I want to be specific to the glute med, I need to maintain internal rotation. And if I want to work my middle fibers, I have an angle. But if I want to work my front or posterior fibers, there's different angles. It's not one exercise for all 3. But let's say that IT band issue is coming from tight middle fibers, right? And I'm given a clam. And even though it's not specific, it's causing tension down that chain. Well, if it's tight and I have inflammation, I have a tendonitis there, it's gonna make it worse. So I don't wanna give them that. I'm gonna give them a specific stretch for the glute med because I wanna loosen those fibers. I wanna release the fascia and the tubes that are within the fascia to normalize it. I don't wanna put tension on it because it's already tense and congealed. I don't want to do more of it. So that's an example of how a specific exercise program can be dealt, right? There's more factors involved, but it's not just one thing for one thing. If you're at the point where you're kind of acute and before you need really big medical intervention, then please seek out a therapist that also knows this kind of specific stretching exercises. The best for me that I've found so far has been a Soma therapist and a Soma trainer combined. They'll be able to give you the therapy and the exercises specific to the therapy that you need for your issue. If you don't know anybody, if you can't find anybody, put where you are, like let me know in the comments below. I'll see if I know somebody in your area and try and help you out best I can. If you're not super acute, or if you don't want to even get to the acute, you want to learn these things to take care of yourself, to give yourself some love, so you can keep this body and use it and give it love for the rest of your life, then reach out for a free diagnostic consultation. We'll talk about where you are now, where you want to go, what you've done, what you're doing, issues you're coming across, and I'm going to give you valuable information no matter what. And if I see you're a good fit, I'll offer my services here in-house, online or online program. It just depends on what works best for you. So if you have any questions, please put them in the comments below. I'll be glad to help and answer as quick as I can. Stay tuned for next week. Have a great day.